Hey guys, Woodruff here. Let's go over some more cardiovascular practice questions because I just can't get enough of this topic. This is my favorite topic to talk about. So the purpose of this video is to help you to start to kind of dig through some of the content and see how we could ask questions, like what kind of questions could we ask? How could we present some of this information? It's also helpful to kind of see it in situations and scenarios, things that can come up, and then also look at some test taking strategies together. So hopefully this is helpful to you. And this is more for the Surg class for, kind of the disease processes that we are going over in that course. So with that being said, let's go to question 1. A nurse is caring for a client with congestive heart failure. What intervention is most helpful for the nurse to perform to encourage a decreased fluid load? So there's a lot here. Let's break down this question. First, it's saying that, we have to think about what the disease process is. Anytime that you're reading a question, you always want to see what disease process, because when it's asking this question, it's not just asking in general, it's asking for the specific patient. Because sometimes you have to think about what's normal and what's not. So for example, for a patient with congestive heart failure, and I'm not even looking at the rest of the question, we just want to always consider that their normal may look different than other people's normal, or some stuff that they have going on. They can be pretty sick or have some heavy symptoms. So we always want to consider we're specifically talking about this disease process. So always kind of keep that in your head, like what disease process am I referring to? So it's asking what intervention for congestive heart failure is most helpful. And remember, you hear most helpful, you have to think about, okay, what's going to be most direct, most useful, or have the biggest effect for this client. And not just what intervention is most helpful, but it's saying specifically to encourage a decreased fluid load. So pretty much heart failure, what's the best thing that I can do to lessen the amount of fluid that they have? So choice A, let's look at our choices. Weigh the client daily at the same time. Well, I think weighing the client will definitely help me to know if they're gaining fluid, but to actually physically decrease their fluid load, I can't see how that's going to help to actually decrease the load itself versus just know, hey, it's getting higher or it's getting lower. So in other words, this is a tricky one that a lot of students may get caught up on, is that they may see, hey, weigh the client. Yeah, that's good. That's how I tell that their fluid load is up or down. So a lot of times students choose this, but just weighing them, like, let's say, I have to think this. I have to think like, okay, let's say that I do weigh them at the same time every day. Is that actually going to help them to have less fluid? So weighing them at the same time every day is going to help a client with congestive heart failure, but it's not going to change the amount of fluid that they have. It's just going to help me to measure it or track it. So I don't really like A, because I don't think it's very direct to help me to actually decrease it versus just know, hey, there's a problem here. Listen to the client's lungs every shift. Well, this is kind of like A. I can listen to their lungs and I can see that they have more or less fluid. I can see how other interventions are working, but I don't see how it's really going to help me to decrease their fluid load. Listening to their lungs, I may see, hey, they have less fluid, or hey, they have more fluid. But again, it's not going to actually change the amount of fluid in their body. So you always have to think about what it's asking you here, because a lot of times students could choose A or B because they think, hey, they read the question too quickly, or they just think it's asking what intervention is helpful for a client with heart failure. And I'm definitely going to weigh them daily. I'm definitely going to listen to their lung sounds every shift. But are these going to specifically help? And are they going to not only just specifically help, but be most helpful to decrease their fluid load? So far, I haven't had any winners. Let's go. Small, frequent meals throughout the day. Well, I definitely, again, want to do that for heart failure, but I don't think that has anything to do with fluid load. So this is another one where sometimes, students, they get really caught up because they hear something in class over and over and over again, and they can choose an answer just based on because they've heard it a lot. So this is just one of those things that if you're one of those people that always goes for what you hear a lot in class, I'm here to tell you and break your heart a little bit that a lot of times the correct answer choice is not the thing that we talked about the most in class, or not the first thing, it's not going to be worded exactly in the way that you want it to be. So don't always go like for the answer choice that you think, oh, this has sometimes you read a question, you're like, oh, I know what the answer is here. diuretics. Well, I don't see diuretics as an answer choice. So if diuretics is not there, then I have to go through, I always want to go through every answer choice, no matter what. You never want to already get married to if you get married to an answer choice before you look through everything, you can end up choosing the wrong answer. Now, sometimes maybe it's the right answer, but a lot of times students, when they get really married to saying this has to be right, or I've seen students, I've even talked to students that like chose the wrong answer, but they said part of it was so right they had to choose it, even though they knew part of it was wrong, but part of it was so right they knew it had to be true. Like, they changed it in their mind, or their mind convinced them this has to be it. So I would just recommend, as a test taking strategy, don't get too married to an answer. Or, it's okay to sit there and think, hey, I think that this is what the answer is going to be. But if you don't see it there, like that's where your heart drops. And you're like, oh my God, my answer's not there. What do I do? So kind of go in with an open mind and try to look through each one, no matter what, and just make sure that you're thinking about, okay, what's going to be most helpful, most direct, which of these is actually going to be useful. So if small frequent meals throughout the day, that's going to help with nutrition. It's going to help maybe with some of their energy conservation, but that's not necessarily going to help with decreased fluid load. So if this question said what intervention is most helpful for the nurse to perform to encourage adequate nutrition or to help with energy conservation, C would be the best answer here. But that's not what the question says. It's asking about decreased fluid load. So then we go to D. It says avoid frozen meals and processed foods. This is the only one I really have left, so I have to think about this. So how would that help? I know that frozen meals and processed foods have a lot of sodium. Yep, I know you were thinking the same thing I was. Because of this, we do want them to have lower amounts of sodium, because if they have less sodium, then they're going to be retaining less fluid. So D is the only one that's actually going to actively help them to lose fluid, because if they have less salts, they'll have less water, and then they'll have less of a fluid load. So the correct answer here is going to be D, avoid frozen meals and processed foods. Question 2, a nurse is caring for a client taking lisinopril. Ooh, med question, your favorite, for their hypertension. Which of the following laboratory values would the nurse need to contact the physician about before administering the medication? So there's a lot of labs in this section. There's going to be labs related to meds and then just general cardiovascular labs. This question's asking about labs related to medication. So this would require me to know what lisinopril is, like what medication class it belongs to, and then also, what kind of complications can come. So first, I can look at my labs, and because sometimes what happens, sometimes we'll give you a question like this and only one lab is actually out of normal range. So I can look here and see that it looks like all of these are out of normal range. So that's not going to help me here. So for example, if you had a question that said, hey, which one of these labs is concerning? All of them are normal except for one, you know that it has to be that one that is the correct answer, that there's something wrong with it. So in other words, sometimes we can just look in a lab question, see what's abnormal. Not always, but sometimes. But in this one, everything's abnormal. So now I need to know which one of these it makes it not safe to give lisinopril. And it's not to say that since all of these are abnormal, it's not to say that all these aren't scary or dangerous, but this is really important in a question like this for you to understand, is that when you're looking at a question like this, it's really asking you is specifically for lisinopril, for this medication, which one of these, if I give this, if their lab is this and I give this medication, there can be a serious complication. It's not saying like, because again, if all of these are abnormal, I'm probably going to need to do something about many of them, but which one of these is related to lisinopril? So first and foremost, we have a low potassium. So I have to know what happens with lisinopril and potassium. Now, if I know what lisinopril is, prils make your blood pressure chill. They are a ACE inhibitor. And so ACE inhibitors, if I remember correctly, block the RAS, which therefore lets go of more sodium, which means I'm going to hold on to potassium. So my potassium is going to increase. So while I'm probably going to need to replace that potassium, it's not unsafe to give lisinopril with a low potassium, because if my potassium is low, lisinopril is actually going to increase my potassium, which would be helpful. So, if I need more potassium, lisinopril might actually help a little bit. Now, it's not a potassium supplement. I'm still going to probably need to replace my potassium. But in other words, it's not unsafe to give lisinopril. Like something bad's not going to happen if I give lisinopril and the potassium stat. Now, some people may get caught up on this because they remember something about potassium lisinopril, but you just have to remember which direction that potassium goes with lisinopril. And so if this was a high potassium, if this was like 6.3, then yes, this would be the correct answer. Because it's low, it's not the correct answer. Now I have a serum creatinine of 2.5. Now, since lisinopril works on the RAS system, which is in the kidneys, I think it can mess with kidney function. So it might be something I want to bring up. So I'm going to say maybe for B, but let me look at my other answers. So then I have C, the white blood cell count of 15,000. So that's a sign of infection. Then I have to think about, okay, or inflammation. So it's having infection or inflammation affected ability for someone to take lisinopril. I don't think it does. I mean, they're probably going to need treatment for that, but I don't think it affects their need for their hypertension medication, and that it's unsafe to give. Then D, hemoglobin of 7.9. So it's definitely lower on the low end of normal. We usually don't transfuse until it's less than 7, but I don't know that there's anything about having that that's going to affect their ability to take their lisinopril. Like having a lower hemoglobin is going to affect their safety around that. So I think the only one that may be unsafe to administer would be the serum creatinine of 2.5, because I think if we administer this, because again, I want you to always think, okay, what's going to happen if I give this? What's the consequence? If I give this and my creatinine is 2.5, that can get even worse, and my kidneys could go into complete failure if they're not already. So lisinopril is hard on the kidneys. So we always want to kind of keep in mind that a lot of times when patients come into the hospital and their creatinine's up, we hold their lisinopril and we give them something else. So B is the correct answer, that I would need to contact the physician before giving that lisinopril if their creatinine is high. And just as a side note, you definitely want to, I would recommend flashcards for a lot of these laboratory values, but don't just memorize the number, really see what it means. Like, so some people may know, hey, 0.6 to 1.2 or whatever is normal for creatinine. But do you know what it means when it's high? Do you know what it means when it's low? So always kind of know what it means, what it looks like, or kind of how it will affect. You have to think of it in scenarios. So definitely practice some scenarios. I have some scenario documents on my Google Drive. All right. Question 3, a client is being discharged with coronary artery disease. Which instructions should the nurse include in their discharge education? All right, so client's being discharged and we're trying to see like, what do we need to include? So like pretty much this is testing your knowledge to see if you know what coronary artery disease is and what are some of the key things that we want to teach them. So in this one is saying just what should you include? So this means that only one is correct. So we're kind of doing this like a true false. What is correct about coronary artery disease? So to answer choice A, chest pain is expected. Utilize nitroglycerin as needed to manage your symptoms. So the thing about coronary artery disease is this is that one that's like in between, like, where it's like, it's just risk factors. There's no symptoms here. So I don't think really in general, we're ever going to tell people, hey, you're going to have chest pain. So yeah, just deal with it. So usually we tell people have chest pain. Here's what, do this and, let your doctor know, or you report if you have chest pain. And that's going to be true for coronary artery disease too. Like if a patient with CAD is starting to have chest pain, they're actually progressing into angina or chronic stable angina. So we definitely want to report that. We never want to normalize like, hey, you're just going to have a lot of chest pain, it's all right. Just don't even worry about it. Like, we want to make sure that they know when to report that and when it's getting more serious. So I'm going to say A, nah, I don't like that one. B says you should only do light exercise to decrease your risk for heart attack. Well, if I remember correctly, that usually for cardiovascular health, we want to do moderate exercise. So I know that we don't want to stress the heart or stress the heart out, but I know we also need exercise to decrease a lot of risk factors, and coronary artery disease is all about decreasing risk factors. So I think this would be correct if it said, do moderate exercise, but I don't like the light exercise thing, but I'll keep it in the back burner. You should increase your fluid intake to 3 to 4 liters of fluid daily. Well, hypertension sometimes goes with coronary artery disease, or we definitely don't want them to have too much fluid. I don't see how, because in cardiovascular health, we definitely want them to be hydrated, but we're not like, it's not like respiratory where we want them to have more fluids. I don't see how getting 3 to 4 liters of fluid a day is going to help in CAD. It could actually overload the heart or put more pressure on the blood vessels, which could stress them out more. So I don't really like that one either. Then D is monitor your blood pressure and take prescribed antihypertensive therapy daily. Well, that kind of goes with what I just said. Like, you know, like you have to think about with coronary artery disease that it's all about risk factors and that we're pretty much trying to manage those like lifestyle things like obesity, diet, exercise. And then we also want to manage other conditions like diabetes and hypertension. So I think the best answer here is going to be D, that we want them to monitor their blood pressure and take their antihypertensives daily, because that's going to help to see like if they're having a problem or not managing their hypertension well, it's going to affect coronary artery disease, which remember is just where you're building up blockages in your coronary arteries that supply blood and oxygen to your heart. So it can pump and do its beautiful job. And if my blood pressure is super high, those blood vessels are narrower and they're not going to be able to get as much flow there. And then also it can start to break down some of the lumen of the blood vessels and lead to some of the destruction or breakdown of those blood vessels. We definitely don't want that. All right, so D was the correct answer there. So question number 4, a nurse is caring for a client taking a beta blocker. Whoa, so this is something that's important. So we can give you a specific medication or we can give you a class. So you definitely need to know both. It says, what assessments should the nurse complete prior to the administration of this medication? Select all that apply. So we want to see which of these assessments is going to be key for these patients. So select all that apply. We always treat like a true false. So we always want to look at this and just kind of go straight down. We don't want to go back on our head and try to like say, well, oh, I have to choose at least this many, or this is not enough, etc. It has to be at least 2. It can be all of them, but usually at TCC, we do not select all of them. We usually, most of the time in our class, I can't speak for other classes. I don't want to speak for the college as a whole, but in our class, then we usually don't select all of them, but don't play games is pretty much what I'm trying to say. Just go straight down true or false. So what do I need to do before taking a beta blocker? Well, beta blocker is a medicine usually for blood pressure. So A, check the client's blood pressure. I think that's a pretty smart move. So I've got A, true. Assess the client's pedal pulses. Well, I mean, I might want to see how their perfusion's going, but I don't necessarily think that you have to check a pedal pulse before you give a beta blocker. Like it's not, we want to think about in this question is what assessments do I need to complete to safely administer this medication? Like, how can I be safe with this? And whether or not they have, like, there's nothing about checking their pedal pulses that's going to change me from giving the medication. Because you want to think about what am I going to, you could also word it this way. What am I going to check in order to see if they, if it's safe to give this medication? So like, I have to think about, is there anything that could happen with their pedal pulses where I would not give an antihypertensive? And there's really not anything that I can, there's nothing that I can, that can change in my pedal pulses that would affect my ability to give a beta blocker. C says, look at the most recent potassium levels. So I have to think about, okay, so far I have A is true, B is false. So C, potassium, is there anything, do beta blockers affect potassium? Well, there's many medications that are antihypertensives that affect potassium, like loop diuretics, and then also ACE inhibitors affect potassium, digoxin. And stuff like that has a relationship with potassium, but I don't think there's anything that could change on a potassium level where I would be like, oh, their potassium is this, I can't give my beta blocker, or I need to hold it. I always have to think about the doctor might write an order, hold this if this parameter is not met or is met. So I'm going to say false for that one too. Measure the client's current heart rate. Well, beta blockers, I know that this is one of those that lowers blood pressure and heart rate. So I'm going to say true for D. So far I have A and D as being true. And it says, if diabetic, check a blood glucose. So if I remember correctly, all beta blockers hide the blood sugar drop because they block the sympathetic nervous system, which hides that fight or flight that I get when my blood sugar is low. So if I am diabetic, I probably do want to check a blood glucose just to see where they're at before I give that, so that I know that if they're low, that I'm going to be looking for needing to check their blood glucose more closely. So far I like, or the ones I like now at the end is A, D, and E. So I've selected it, true, false, straight down, not changing any answers, not going back and comparing, not going back and double checking. A, D, and E, good to go, move forward. And that is the correct answers. So we're going to check the blood pressure, check the heart rate, and if they're diabetic, check a blood glucose. All right, let's look at question 5. A nurse is caring for a group of clients on a med-surg unit. Which of their clients is most at risk for developing, that should be developing, deep vein thrombosis? So this is a risk factor questions. And with risk factor questions, we always want to count who has the most risk factors. So I've brought up in other videos, what we do is I start at the beginning and I count up how many risk factors that a patient has, what do you call it? Try to see, like, like I pretty much tally them up. So on your scrap paper, you can tally up how many risk factors each had, because this is not measuring who has the biggest risk factors, it's who has the most risk factors. So it's just a count. So let's look at the first one, a 22-year-old female. So what was I going to say? There's not necessarily a gender thing that has to do with DVT risk, but I do think if you're older, you're more at risk. So she doesn't have that risk factor. Hormonal birth control is a risk factor. So that's one. Marathon runner. So staying active is a great thing that actually helps prevent blood clots. So I think that she only has one risk factor. Second one, a 54-year-old male. He's middle-aged, so he's not really older, but he has atrial fibrillation. That's a huge risk factor. And recent femur fracture. That's 2 risk factors. All right. So now we got 2. 66-year-old female. So she's older. Drinks socially. Alcohol is not a risk factor, even though smoking is. Smoking is definitely a risk factor. And has a history of osteoporosis. Osteoporosis is not a risk factor for deep vein thrombosis. So she only has one risk factor. 40-year-old female. Okay. Her age, she's not that old. BMI of 22. If you don't know, normal BMI is less than 25. So she's obesity is a risk factor, but she's not obese. In the hospital for UTI. UTI is not a risk factor for DVT. So so she has 0 risk factors really. Aside from the fact that she's in the hospital. So maybe she's, don't create a story here. I'm going and I'm falling for the regular tricks. Like, right, don't create a story here being like, well, obviously they're going to be on bed rest and not be able to move. If anything, if she has a UTI, I could make up the story that she's getting up constantly because she has frequency. But we don't need to create a story here. It's really just looking at the simple facts of which of these is risk factor, which of these patients has the most risk factors. And the only one who has multiple risk factors is going to be B, 54-year-old male with AFib and recent femur fracture, not long bone fracture. But anyway, really here, when we're talking about DVT, you want to think about people that are immobile. You want to think about people that have hormonal treatments that they're getting. You want to be thinking about people that have any sort of stasis of their blood, where their blood's just chilling in one area, like heart failure and stuff like that, or some of the venous diseases like we talk about, like varicose veins, things like that. So, and then with risk factor questions, just count up who has the most risk factors. Number 6, a nurse is caring for a client with peripheral artery disease. Which intervention is most appropriate to include in the nurse's plan of care? So this is saying, we might be able to include all of these in the plan of care, but what's most appropriate, what's going to be most direct or most helpful to this patient? So PAD, this is that one that's in the arteries that can lead to decreased blood flow. So let's see what we got here. Check the client's feet daily to assess for breakdown or injury. Well, I like that, because I'm pretty sure we treat PAD a lot like diabetes, where we do the diabetic foot care, where we want to check their feet because they have less circulation. I think they can't feel as much. So they don't know when they get breakdown. So I like that one so far. But remember, it says most appropriate, so we got to see what's the best one. Monitor INR levels to assess if anticoagulation is therapeutic. So this is really asking me, does a patient with PAD receive anticoagulation? And if I remember correctly, I don't think they get anticoagulation. They only get anticoagulation if they're an AFib or if they have a blood clot. They don't have a blood clot here. They just have plaques. And if I remember, what do we do for plaque problems? We do We always go with the antiplatelets. So antiplatelets are the anti-cloggers or the anti-plaques. So think antiplatelets, anti-plaques. So anyone who has plaque buildup, we're usually using antiplatelets. So I don't like B because I don't think it's necessary. C, encourage client to sleep with their legs elevated to encourage circulation. Well, this sounds like, so this is very common. What we might do in a question is we might give you a correct answer choice for another disease you need to know. And who needs to elevate their legs? That's going to be people with venous disorders, not arterial, because what we always have to think about arterial, legs dangling, venous, legs elevated. So arterial, we like to dangle. That's going to help them more. If we elevate them, it's going to make their circulation even worse. So I'm going to say no for C. And D, use heat packs directly on the legs to encourage circulation. So heat does help to vasodilate and encourage circulation in some ways. But I don't like that directly on the legs because you have to think about this. We treat this patient like a diabetic and we don't want temperature extremes on their skin because they can't feel it. So if they get burnt or if anything gets broken down, it could damage their skin. I want to avoid all injury with PAD because if that injury, they're not getting oxygen to their tissue so they can't heal. And they also can't find it. And so they can end up like needing amputations and having really bad skin issues. So I definitely want to be cautious there. So I do not like this answer. So because I think that it could cause injury. So the only one that I'd like and I think is appropriate for this patient is going to be A, to check their feet daily to assess for breakdown or injury. So we do treat PAD just like diabetes, and we do that daily care, make sure that they're taking care of their feet, checking them regularly, looking for breakdown, and doing things to prevent injury to those their limbs. All right, number 7. Oh no, labs. So it says a nurse is assessing laboratory values for a client with hyperlipidemia. Which intervention would the nurse anticipate as a result of these values? So this requires me to know what the normals are for these values and then also know what to do about them. So I've got an LDL or low density lipoproteins of 143, and the normal, I remember LDLs, we like them low, and that seems pretty high. I believe we want it less than 130. Then total cholesterol 215. I think this is what we want, less than 200. So both of these are high. So I'm thinking that we're going to want something like something to lower it more. So this is pretty much asking how the treatment is going. So the first choice is the client is responding well to their treatment and should just be monitored. Well, these labs are abnormal, so I'm going to say that cannot be correct. So I'm going to go to the next one. It says the client is experiencing a complication of their treatment. It needs to be stopped. Well, there's no signs of a side effect here. Now, some students may get caught up on this because they're like, oh, the complication is that their cholesterol is going higher. But that's not a complication. It's just showing that their medication is maybe not effective yet, or they don't have enough. So it's not an actual complication that their cholesterol is higher. It's not a side effect of medication to increase cholesterol. Like, sorry, when I'm saying that is that like if someone has hyperlipidemia, it's expected for their cholesterol to be elevated. It's not as a result. Like if someone's taking cholesterol medications, it's not a complication that their cholesterol is still going higher. It's just showing, hey, maybe this isn't the med for them or they need more. So then C, the client has received too much medication, needs to be decreased. Well, no, I need the opposite of that. And then we get to D, the client is not receiving enough of their medication, it needs to be increased. So that is the best answer there is that their cholesterol is high, which means they're not getting enough medicine and they may need increased amount of medicine. That's for a doctor to decide, but it's good for us to know, hey, something's not working here. It's kind of the same as like, let's say I'm taking care of a patient with diabetes and I'm giving them their insulin every day, following the protocol, but their blood sugar is still in the 200s. It's my job as the nurse to say, hey, to the doctor, like, you know, I'm giving this medicine, but it doesn't seem like it's enough. Like, I think they might need an increased dose. The doctor will decide that, but it's our job to kind of point these things out because the doctor is going to review everything, but it's our job to kind of help pinpoint or show them trends that maybe if they didn't have the time to see or they did not notice. Since we are that first line there, it's so key. The other test taking strategy here is that both C and D are like the same answer, but opposite. So a lot of times when there's two answers that are very similar, but opposite, then a lot of times one of them is going to be correct. So let's say I didn't know about A or B, I can go to C and D and say, hey, it's probably one of these that's going to be correct. Because usually if we have two that are opposite there, we're trying to see if you can discern if it goes up or if it goes down. So D here is correct. Their cholesterol is high, need more medicine as a result of that. Last but not least, a client is taking digoxin for heart failure. What symptom in this client is most concerning and should be reported immediately? So we can also, for medication questions, give you a medication and say, what's a sign that there's a problem with this medication? And specifically, this one is saying what is most concerning. So it's not saying like, hey, which of these is concerning at all, but what's most concerning, or which one is going to be a sign of like, hey, there's something really not right. And it's specifically for digoxin and for heart failure. So I'm taking digoxin for heart failure to increase my heart squeeze so that I can have better cardiac output. But I'm going to look here for my answers. And if I remember anything about digoxin is toxic. So I always need to make sure that I'm looking for those signs of toxicity. So that's probably what this question's asking, is I'm looking for signs of digoxin toxicity. So client is complaining of muscle pain and spasm. Well, I know that that's a side effect or a problem with statins, like the simvastatin, et cetera, but I don't think it is a problem with digoxin. It's not a sign of toxicity, not one at least that I would be most concerned about. Client is having nausea and feels like they need to vomit. Now this one, I believe that early signs of digoxin toxicity are like GI symptoms like nausea, vomiting, or they can have diarrhea. So part of me wants to choose this one, but let's keep going just to make sure that this is the best answer. Because remember, most concerning. Client has wet lung sounds and is short of breath. So, I mean, that sounds like a sign of heart failure. And so a lot of students may read this question and be like, ooh, wet lung sounds, short of breath. I don't like that. I need to report that immediately. That's ABCs. But here's the thing, while it may be ABCs, it's not answer. You have to think about what answer choice actually answers the question that's being asked. And the question that's being asked is, what can happen with digoxin? So is wet lung sounds and shortness of breath a sign of a problem with digoxin? No, it's not. Is it a sign that the patient has heart failure? Yes, it is. Is it a sign that they maybe need help with their heart failure? Absolutely. I should say this is, I don't want to even say that. Like, it's not necessarily, because having wet lung sounds and being short of breath is very expected for a patient with heart failure. Like, it's part of having heart failures. They're congested, they're full of fluid. We may need to do something. It just depends on the patient's baseline and depends on how much they're struggling, what their oxygen saturations are. But keep in mind, this is there as a distractor for a reason, that because people see heart failure, so they think, okay, what symptom in heart failure is most concerning? No, it's saying what symptom related to digoxin is most concerning. So the wet lung sounds and shortness of breath has to do with heart failure, may need some intervention, but it doesn't have to do with digoxin. It's not a result of the digoxin. Then we have D, client has a heart rate of 110 beats per minute. So this is kind of the same as the last one. I'm going to expect their heart rate to be increased a little bit with heart failure because the heart's working harder. The sympathetic nervous system is usually activated, but this is not a sign of a problem with digoxin. Because actually with digoxin, what I'm worried about is not toxicity. I'm worried about them having too much. Digoxin actually lowers my heart rate. So like, again, this kind of goes back to that first question where I'm looking at when is it going to be safe to give? And if I give digoxin and their heart rate's 110, if anything, it's going to help. It's going to help lower that because it decreases my conduction. It decreases my heart rate. But if they're having nausea and they feel like they need to vomit, that's a sign of toxicity. And if I give that digoxin, it's going to get even more toxic and they could actually end up with a very low heart rate. So the only one here that is actually directly related to digoxin as a sign of a problem is going to be B, the nausea and vomiting as a side effect. And hopefully that makes sense. I know sometimes breaking down this stuff is hard, but hopefully I'm giving you a perspective where you can kind of start looking at these questions and see, okay, how can I approach these questions differently and see how I can, better understand really what this question is asking me. Because like 9 times out of 10, when I talk to students and they're struggling on exams, they know the information, but they're just not reading the question right. So always make sure you know what the question's asking you. Anyway, I hope this helped. I'll see you for the next one.